India's anti-colonial nationalist, late Mahatma Gandhi, said it is health that is real wealth and not pieces of gold and silver. This clearly places very high premium on health above everything other thing or possession in life. It also explains the reason for the launch of the campaign by the federal government to protect more than 28 million children against measles and meningitis. The campaign became necessary in view of reported cases of measles in the northern states of the country and owing to the vulnerability of infants to this childhood killer disease. Tackling cases of measles in Nigeria is the focus of discourse on this edition of Frontiers. I am Obiageli Ugoke, and to give deeper insight into the causes, treatment, as well as ways to prevent the disease, we have in the studio Dr. Deze Ore, consultant, family physician, Department of Hospital Services, Federal Ministry of Health, Abuja. Doctor, you're welcome to the program.
Thank you very much for having me.
The program continues shortly after this excerpt.
Record shows that immunization and vaccination are two of the most important public health interventions and constitute a cost-effective strategy to reduce both the morbidity and mortality associated with infectious diseases. Advancement in medical science is such that children can be protected against more diseases than ever before. Some diseases that once deformed or killed thousands of children have been eliminated completely, and others are close to extinction due to safe and effective vaccines. The expanded program on immunization in Nigeria is therefore aims to improve the health of Nigerian children by eradicating all the 6 childhood killer diseases, which are polio, measles, diphtheria, whooping cough, yellow fever, and tuberculosis. What would have therefore been described as a boost in the expanded program on immunization is the introduction of the measles second dose at 15 months by the federal government. The federal government has introduced measles second dose at 15 months into the routine immunization. Therefore, apart from the usual first dose of measles at 9 months, all children are to be vaccinated at 15 months. The second dose of measles is an opportunity to fully protect Nigerian children against the deadly measles disease.
Measles is a serious respiratory disease that has resulted in the death of a significant number of children over the years in Nigeria. However, cases of the contagious disease can best be described as relatively low in Borno this year, as only Bama and Munguno, out of the 27 local government areas, experienced the outbreak of measles.
The last major outbreak of measles we had was in early March this year, and this has to do with a lot of population that are coming out from previously trapped populations. So they were not able to have vaccinations during the last campaign and also the in-between round activities.
The insecurity that bedeviled the state has not deterred Borno State Primary Healthcare Development Agency from recording huge success, as it has so far reached 96% coverage in terms of vaccination.
We have made effort to reach all accessible areas and also areas with apprehension that are a little bit difficult. We use the security apparatus to help us go into those places and immunize as much eligible people as we can.
People are bringing out their kits for vaccination in all the areas that our vaccinators are placed.
Inhabitants from 4 inaccessible local government areas of Abadam, Kuka, Marte, and Guzamala are also benefiting from the routine immunization exercise against measles in various camps within the state capital.
We know that in Borno we have a lot of places that are inaccessible, and we have some places in the fringes of the insecurity. And that is where we have to collaborate with the security agencies, with the civilian JTF, to be able to reach those populations with vaccines as well.
The success story of the minimal cases recorded against measles in Borno State this year can be largely attributed to sustained support by concerned individuals, especially in the area of providing adequate vaccines, as well as massive cooperation on the part of beneficiaries and stakeholders.
All right, once more, you're welcome to the program.
Thank you very
Now,
much.
doctor, measles is one of the 5 killer diseases of infants in Nigeria. What are its distinguishes characteristics?
So the thing with the killer diseases is that the 5 killer diseases is they're all vaccine preventable. So even though the other vaccine preventable diseases apart from measles like polio, tuberculosis, whooping cough, tetanus, diphtheria, they all have distinguishing features, and even though they all mostly present with fever, which measles also does, measles has the distinguishing characteristic of a reddish rash that appears on the body, and then some whitish spots that can be identified during clinical examination of a suspected case of measles.
Why does it spread so rapidly? Because according to statistics from the Center for Disease Control, we have about 6,000 cases, and out of that, 15 deaths are already recorded.
The reason why measles spreads so rapidly is because it's airborne. So it's a virus, and it's transmitted through what we call the respiratory droplets, which are the droplets that come out when an individual sneezes or coughs. And so that travels in the air and can infect anybody around. One person that is infected with measles can transmit that measles virus to up to 18 to 20 people. So you can see that because it's transmitted in the air, it can travel very widely. And so that's why we're having so many cases, primarily because of low immunization coverage.
Now, what are the signs or otherwise symptoms of measles?
So the signs or symptoms that individuals would present, say a parent or even an adult that has measles: fever, a feeling of weakness, feeling of there may be cough, there might be sore throat, of course, aside from that reddish rash that appears all over the body. So these are just some of the signs: the weakness, that general feeling of unwell, feeling having pains, muscle pains and joint pains. So those symptoms, I'm sure from hearing them, you can tell that they could be any other thing. They could be accountable to any other infection. But that reddish rash and those spots that are identified in the mouth of some measles infected individuals are specific for measles. And so there's the need for a medical diagnosis to definitely confirm a case of measles.
Because from available statistics, we see that the cases of measles are more prevalent among children. Are there factors that predispose infants to this disease?
Yes, as infants and young children, their immunity is definitely lower than adults. So that is why the immunization or the vaccination against measles is something that is in our national program of immunization, so that the immunization that the child is born with, which wears off as time progresses, is now boosted by that vaccination. And so why we're hearing of large number of cases now is because a lot of these children are not immunized, a lot of the community are not immunized, and so the population is vulnerable to measles outbreaks. The World Health Organization says that at least 95% of the community should be immunized or vaccinated against measles for the community to be protected. What that means is if 95 to 97% of the community are vaccinated against measles, then it will only be a very small proportion who would be infected with the virus.
Now, you say some communities are not vaccinated, and the federal government recently launched what is it called?
A vaccination
A
campaign.
vaccination campaign,
Yes.
which is aimed towards tackling this disease. Those communities that are not vaccinated, are there plans to incorporate them in this plan of tackling the disease?
Yes, what the government is doing through the National Primary Healthcare Development Agency and support from World Health Organization and Gavi, the Vaccine Alliance, is they've trained a large number of health workers who will support the staff that are already involved in routine vaccination. So they will go into, the plan is to go into these communities, go to churches, go to mosques, go to the marketplaces, go to schools, and also public places in the communities to make sure that every single child in those communities has the opportunity of being vaccinated against measles. So it's actually a very robust campaign with a lot of support. And I'm sure that even children in those hard-to-reach areas, they will reach a lot of them.
It is a fact that measles is a childhood disease. Can older adults contract it?
Yes, older adults who are not immunized, who have not been vaccinated in the past, are also vulnerable to measles infection. And in fact, the infection in the adults could even be very severe because they don't have immunity against the measles virus. And so they may be more prone to having complications, even as adults. So even though we know that children under 5 are prone to complications, adults over the age of 20 are also very susceptible to complications, pregnant women as well, and people who have weak immune systems and individuals who are malnourished. They are very prone to coming down with complications of measles, and the infection can be very severe in them.
How dangerous could that be in adults?
In adults, measles can bring about severe cases of pneumonia and bronchitis, where their breathing is compromised and they can actually die from respiratory depression. It can also lead to inflammation of the brain and the surrounding tissues of the brain. So they will present like people that have meningitis and may lose consciousness. That is how severe it can be. And of course, we also know that measles is one of the common causes of blindness in environments like ours. So it can also cause blindness.
Oftentimes we hear about immunization for children. Don't we have immunization for adults?
So for an adult who does not know if they have ever been immunized or knows for sure that they've not been immunized, they can be vaccinated to protect them from measles infection.
Okay, and where can they access these vaccinations?
The vaccination should be available in primary care centers and secondary and even our tertiary hospitals where routine immunizations take place. That is where they can get viable vaccination to protect them from measles.
Now, there are increase in reported cases of measles, especially in the northern parts of the country. We heard about 5 states are presently affected. What do you think is responsible for the increase in these cases of measles?
So for a while now, in the northern part of Nigeria, there are many areas that have been exposed to conflict. And so because of that conflict, we have a lot of internally displaced people who are now in internally displaced persons camps. And those camps are somewhat overcrowded, and immunization coverage in some of these camps has been low and suboptimal. So that's with that crowded situation, and of course the sanitation and environmental challenges in such camps, then we understand why there's been low immunization coverage rate, and then more people are prone to spreading such infections amongst themselves. And then of course that leaves host communities prone to being exposed to outbreaks of measles.
Okay, but this class of people, are there plans for them to also benefit from this immunization?
Yes, because the reactive vaccination campaign that is ongoing is also taking into consideration people who are in the IDP.
Are they going to be distributed to camps?
Yes, and so that's why WHO actually trained about 44,000 health workers, and they are planning to have the government with WHO and Gavi are planning to have up to 17,000 vaccination teams that would be spread across these states, whether in host communities or in IDP camps or in the general populace, so that everybody, nobody is left behind in the vaccination campaign.
Okay, let's pause here for a while. I'll get back to you. This is Frontiers, so we'll take a short break now. The program continues shortly. Stay with us. The federal government recently kicked off campaign to vaccinate children in northern parts of the country, precisely 19 states in the northern part of the country. What's your take on that?
It's a very welcome campaign because we know that the routine vaccinations have not been able to capture a lot of children, especially in conflict-affected communities in the northern part of the country. So the whole plan and purpose of the vaccination campaign is to recruit even much more support so that children will be reached wherever they are. So in the homes, we have vaccination teams that will be going into the homes, going to schools, going to churches, mosques, marketplaces, and public places as well, so that wherever children are, even in those places that are hard to reach, we will reach them and ensure that they are vaccinated and protected from measles.
How can we ensure that this vaccination gets to those in the grassroots, the local communities who do not have access to hospitals in the city centers? Because most often we hear that other hospitals come to government's primary healthcare centers, they get these vaccinations in bulk and then take to their own hospitals. What do you say about that, and how are we sure that this vaccination will get to those kids at the grassroots?
So why we're confident that it will get to those children is because it's not a campaign where we will be stationed and wait for those children to be brought for the campaign. The way this the campaign is designed is that the health workers will go to every place where we believe that those children are. And that's why I mentioned the public areas.
Without involving a third party.
Yes, and we're also working with the government is making sure that the community members are involved in the campaign. So that for every community members are involved in the working of the vaccination teams to ensure that their people are not left behind. If we don't carry out the campaign with the support of the communities, then we wouldn't be going anywhere. But by involving the communities so that the communities have ownership and participation in the vaccination campaign, then children in those communities will be reached.
Now let's talk about the treatment. How is this measles treated?
So the thing with measles, the measles infection, is that it's not a bacterial infection. So antibiotics typically are not the treatment for measles. So
really?
Yes, because it's a viral infection. So it's more of a supportive management. So supporting the individual who is infected, treating the complications and the symptoms as they arise. So for the cough, using humidifiers to help with their breathing and all that, rehydrating them because they tend to get dehydrated with complications of diarrhea, giving analgesics to reduce the fever, and giving vitamin A supplementation as well, because measles thrives in an environment where vitamin A is depleted. So giving vitamin A supplements are also a way of boosting the immunity and helping the individual recover from the infection. And of course, rest.
Like it is reiterated in medical parlance, prevention is better than cure. Now, what ways apart from immunization can measles be treated?
So while I still want to emphasize that vaccination is still the most cost-effective way of protecting the large populace against measles, there are other ways of preventing it. Good hand hygiene, hand washing with water and soap. It's something that we say all the time, but it is very important. And that's also part of why children are very prone to it, because children, they play, they do all sorts of things, and they're exposed to droplets that may have been infected with measles and can get them infected. So hand washing after using the toilet, before eating, after eating, just incorporating regular hand washing with water and soap into our lifestyle is a way of protecting ourselves and preventing infections like measles. Also, for individuals who may be having symptoms, cough, runny nose, covering the nose and the mouth is another way of protecting the next person from being possibly infected with infections like measles. And then for people who may have symptoms or their children, keep them away from work or school and make sure that they receive medical attention so that the case can be confirmed or shown not to be measles, but at least that minimizes the risk of infecting others. Like I said before, one case of measles can infect as many as 18 to 20 people.
In other words, apart from the immunization, individuals still have their own roles to play. What about the environment? Does it have any contributing factor to the spread of the disease?
So environmental sanitation, keeping our environments clean, is one thing. Having a lot of refuse and garbage around, of course, is not transmitted, is not a foodborne infection, but there's a lot to be said for having a sanitary environment. A sanitary environment encourages individuals to take care of their own personal hygiene. And so we have to emphasize the role of good sanitation, good environmental sanitation as well, in homes, in schools, and in public places in general.
This immunization, when it comes, is it going to be spread across even other communities or part of the country where we don't have the disease outbreak at present?
So part of the national program on immunization, aside from the reactive campaigns that are taking place in the north, by virtue of the suspected cases and confirmed cases that are occurring in the north, we're trying to increase immunization dosing in the southern part of the country, where we don't have reports of those outbreaks, so that we start enhancing the immunity of young children who are still susceptible to measles infection after being vaccinated in the 9th month of life, so that they can receive a second vaccination dose and increase the chances of protection of themselves and the communities.
And what about the pregnant mothers?
So for pregnant women, by virtue of the fact that they are pregnant, we wouldn't be giving them measles vaccine during the pregnancy. But that's why it's important that the general population is immunized, so that the more people who are immunized, vaccinated, and protected in the communities, the pregnant women too will be protected and they have less risk of being infected with measles.
All right. Thank you very much, Doctor.
Thank you very much.
It's been an enlightening discourse.
Thank you.
I have been speaking with Dr. Adeze Ore, consultant, family physician, Department of Hospital Services, Federal Ministry of Health, Abuja, on tackling cases of measles in some parts of Nigeria. Thanks for watching.